I've come to find out that there are multiple testing methods for Lyme disease, and they're not all reliable, not all the time. You know, the Center for Disease Control has a protocol for performing an ELISA test. It was followed in my daughter's case many times. You know, and the test never indicated Lyme, and this led to her misdiagnosis for more than a year. A year that Lyme was able to roam freely about her body and brain before being diagnosed. I've come to find out that there are specialists in the area of Lyme detection that can perform more reliable testing and treatment of Lyme. It's important to know that Lyme is a clinical diagnosis, and there's no test that can tell you that it's been totally eradicated from your body. Black-legged ticks that carry Lyme can also be carrying other associated diseases such as Bartonella, babesiosis, ehrlichiosis, and other diseases. If you've been diagnosed with Lyme, it's possible that you may have one of those associated diseases in your body, and the Lyme test won't necessarily pick it up. My personal experience with knowing people with Lyme is that very few of them ever had some type of rash. You know, if you're blessed with bullseye rash, it's a positive indicator for Lyme, and you should seek treatment immediately. My daughter's message to you is if you have any of the symptoms of Lyme, get to a Lyme and associated disease literate doctor immediately. Our general practitioners may not be aware of or have the time to properly attempt to diagnose Lyme, and the treatments vary. Some doctors want their patients on antibiotics for 2 weeks, some 6 weeks, and some get intravenous antibiotics. If you have Lyme in the central nervous system, the brain, you might need a specialized antibiotic. The medical profession, the state medical boards, and Lyme disease organizations can differ on their suggested methods of detection and treatment. You know, some doctors have lost their privilege to practice medicine in their states because of their aggressive or non-conforming approach to treatment. And Lyme's disease is also a political issue because of all of the unknowns. You know, but as a parent, I look to these boards and doctors to relieve my child's pain any way they can. Otherwise, we can find our children searching the medicine cabinets of their friends' parents or relying on their sick friends to supply them with drugs for relief. You know, no one's immune from getting Lyme. We had a client fly in from the west coast of the United States to the east coast, rent a car at the airport, and they found a black-legged tick on the passenger seat of that rental car. My mother, at 80 years young, who lives in the classic curb Lyme subdivision in an extremely clean home, developed Lyme symptoms. Again, no rash, but her knowledge of her granddaughter's disease made her aware, and she got to a Lyme literate doctor immediately, had it diagnosed, and got treatment. So where did my mother get the invisible tick? Well, she and her husband have so many children and grandchildren that their house is a revolving door of family visits. You know, then there was the diamond salesman who worked for a surveyor on Saturdays. And on one cold January Saturday, he grabbed an old hat from the back seat of a truck, and he got a tick in his scalp. Our dogs and cats bring them into our homes all the time. If you have a company like a surveying and environmental engineering office, your visits to the field may bring the ticks into your office and deposit them on the carpets or in the furniture. So what do we do to stop the spread of Lyme and associated disease? Well, first be aware of ticks. You can take some precautions like wearing light-colored clothes and tuck your pants into your socks. Perform body inspections and concentrate on those areas that are dark, moist, and very difficult to see. You'll need a good understanding friend. Use repellents that say repels ticks or tick repellents. There are chemicals such as Permanon that you can spray on your clothes. My personal experience says that ticks are going to penetrate that first defense and bite you without you knowing. Therefore, I believe it is important for you to know the symptoms of Lyme. I believe that you should constantly watch and be aware of your family, and your coworkers, and your friends for any changes in their behavior or health. You know, Lyme mimics so many other diseases like Alzheimer's and Parkinson's, dementia, Epstein-Barr, chronic fatigue, fibromyalgia, allergies, bipolar disorder, and others. You need to be aware of the symptoms. That could be your greatest defense against Lyme disease. Once you think you or someone you know may have Lyme symptoms, the next thing is to get to a Lyme and associated disease literate doctor. You have a better chance of getting a good diagnosis and a proper treatment. To reiterate some of the well-known symptoms of Lyme, they are fatigue, sleeping disorders, swollen glands, sore throat, fever, chills, headache, joint pains, aches, muscular problems and aches, twitching and paralysis of the face, some call that Bell's palsy syndrome, skin hypersensitivity, sound sensitivity, wooziness, confusion, concentration problems, memory problems, disorientation, anxiety, behavioral problems, mood swings. I mean, who hasn't had any of those symptoms? I encourage all of you to perform your own research on this devastating disease. You should speak with chronic Lyme sufferers. Searching, you should be able to find Lyme and associated disease literate doctors and treatments. You know, the Lyme Disease Foundation, the Lyme Disease Association, and the International Lyme and Associated Disease Society and the Turn the Corner Foundation have provided great awareness and materials for years. Search the web, attend public and medical forums, and speak honestly with your own doctor. Very honestly with your doctors. Let them know your history and what's been happening. You may even choose to keep a diary of symptoms. Thank you.